Hi folks, Scott here with Houston Physicians Hospital Sports Medicine. Here with Dr. Anthony Melillo and the Mako Arm Assisted Robotic Surgery. Let's go find out and see what he has to say. We are here with Dr. Melillo with Houston Physicians Hospital and Bay Oaks Orthopedics Sports Medicine. So Dr. Melillo, what we want to talk about today, especially for our sports medicine crowd, is what is the Mako Robotic Arm Assisted Surgery, and what does that mean for patients who are possibly looking at a knee or a hip type of surgery?
Okay, well, the Mako robot is a device that surgeons use to help do either a total knee replacement, a total hip replacement, or partial knee replacement. It's now owned by Stryker. It's been around for many years, and Stryker bought it about, say, 7 to 10 years ago, and they've brought it to the third generation. The Mako robot allows the surgeon to do certain things that we could not do without the robot. The number one thing, and what I love best about it, it allows me to preoperatively plan my cases. In other words, I could take the patient's problem, I get a CT scan, I send it to the Mako MPS, and he or she makes a 3D model of the patient's anatomy. And then I, with the Mako assistant, I could turn and put in all these implants the way they should be based on that patient. Mm-hmm. So I basically do this surgery virtually before I'm even in the operating room. And I see everything's going to be done, and then I said, this is it. And then we take a snapshot of that, and then when I go into the operating room, that is what we'll do. So I already done the surgery virtually before I get there. Okay. Additionally, the Mako robot allows me to make very precision cuts. A robot can make things pretty much exactly where it has to be. Mm. With me and other surgeons, we're pretty close. We're very, very close. In fact, the more you do, the better you get. But nothing is as sharp as a robot.
For the patient, what does that mean as far as surgical time and then my recovery time?
Right. The surgical time is about the same. It's a wash if I use it with or without the robot. The robot adds a little time and it takes away some time. So it's about a wash. Post-operatively, I have found in the 2.5 years that I've been doing this that majority of the patients have a lot less pain. And I think that's because, one, we have less tissue handling in the operating room. We do what we have to do in the operating room. The tissue is exposed to us. We make one pass with our reamer if it's the hip, or the blade if it's the knee. We put things in, we know where it's going to be, we don't have to fuss too much, and we're out. Mm. I think that translates to less tissue damage from manipulating, and I think the one pass of the blade or the reamer causes a little less bone damage, and the patient does better that way. Plus, the biggest thing I think is especially with knees and even hips, the mechanical alignment is so close to where it's supposed to be that there's a lot less pain for that patient.
Oh, great. You had a recent patient that talked about he had a surgery done by hand a while back, and then another knee that was done with a robotic arm assisted surgery. What were his comments?
He was actually here today, and he's not the first one. We have many patients now. Because 2.5 years ago I didn't have the robot. We have patients all the time that have done surgeries in the past, and then I use the robot now, or some other surgeon has done it. Almost to a man or woman, they say that the Mako robot, they have less pain, they're back to full activities quicker, and they are very enthusiastic, as well as I am, for the Mako robot.
Right. Now, with Houston Physicians Hospital, is this the only hospital in our area that has this technology?
It is. I think there's a total of 11 robots in the Houston area, and we are the only robot in the southeast portion of Houston.
That's great. That's wonderful technology, and it's great for Houston Physicians Hospital. And we thank you very much for your time. Please contact Houston Physicians Hospital Sports Medicine at the link below, or you can go to Bay Oaks Orthopedics and Sports Medicine, contact Angela, and mention the sports medicine program, and we will expedite your care. Again, thank you so much for your time.
Thank you.
Here with Dr. Anthony Melillo at Bay Oaks Orthopedics and Sports Medicine, here to talk about the Mako Orthopedic Arm Assisted, that's not even close, This is our first.
Snap.
I'm here with a bug. Here at Dr. Anthony Melillo's Bay Oaks Orthopedics and Sports Medicine. Speaking of which, there he is now.